Hi, you guys. Welcome back for our daily practice questions. It is day 227. And as always, I like to first start with my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock, a family nurse practitioner and the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. But y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. But before we get started, don't forget to hit the subscribe button so you're not missing any of my videos. And if you would like to gain access to my MP Test Success Toolkit, it is free and linked in the description. My website is also linked in the description and it houses all of the resources that I do offer. And as always, I like to mention if you're looking to just go straight to my business profile where you can see testimonials, you'll see the number where you can call or text, as well as the link to my website. Just simply go to Google and search The Nursing Studio, and it'll take you to my business profile. All right, you guys, question number one. An African American patient with newly diagnosed hypertension and no CKD, what is the best initial therapy? Is it A, an ACE inhibitor? Is it B, a thiazide or a calcium channel blocker? Is it C, a beta blocker? Or is it D, a loop diuretic? Take a moment and tell me what you got, y'all. All right, I always recommend reading the stem of the question first as it allows you to slow down to ensure you're answering what is even being asked of you. So here the stem of the question states, what is the best initial therapy? So again, if we're talking treatment, we need to look and see if they have provided us with a diagnosis. And they have. This is a patient with a new hypertension diagnosis, and they do not have a history of CKD. Also, be sure to note that this is an African American patient. So, initial therapy, the best answer will be B. For African American patients without the need of renal protection, your first line therapy options are your thiazides and calcium channel blockers. Question number two, a patient complains of early morning elevated blood glucose levels. She states that any other time of the day her levels are normal. Based on these details alone, what is the best differential diagnosis? Is it A, pseudo hyperglycemia? Is it B, Don phenomenon? Is it C, Samoji effect? Or is it D, hypoglycemia? Take a moment and tell me what you got. All right, stem of the question states, based on these details alone, what is the best differential diagnosis? All right, so if we're looking for a diagnosis, you got to run it back and look at the assessment findings. So we have a patient who comes in complaining of early morning elevated blood glucose levels, but having normal blood glucose levels all throughout the day, other than this early morning level. This is classic for B dawn phenomenon when you have that at the crack of dawn, so early morning, as early as 3 a.m. You have those sky high blood glucose levels, so hyperglycemia in the morning, but it's normal throughout the day. That is your dawn phenomenon. And lastly, question number three. A patient states that he is noticing elevated blood sugar levels in the mornings, but they are low at night. What is the best recommendation at this time? Is it A, reduce your evening insulin dose? Is it B, increase your evening insulin dose? Is it C, add metformin? Or is it D, skip dinner? Take a moment and tell me what you got. All right, so stem of the question states, what is the best recommendation at this time? All right, so what are we talking about? We have a patient, and he states that he's noticing that his blood glucose levels are elevated in the morning, but they're low at night. All right, y'all, this is classic for Samoji, right? So, due to the Samoji effect, the patient will have low blood sugar levels at night, hypoglycemia in the evening, nighttime, right? And due to this, your body is having a rebound effect, which is causing that morning hyperglycemia. So what you want to do is A is reduce that evening insulin dose. You want to eliminate the cause of what may be contributing to the hypoglycemia at night, because that is the source of the problem. That's the source of the hypoglycemia. So we want to treat that, even if they're not on any medications and maybe they need an evening snack. You have to treat the hypoglycemia in the evening slash nighttime, and that will correct the morning hyperglycemia. All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whoever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any other resources that I do offer, feel free to reach out to the nursing studio by giving us a call. You can shoot us a text message or an email. And if you're looking for my website, as I mentioned previously, it is linked in the bio of this channel as well as in the description of this video. Or if easier, go directly to Google and search The Nursing Studio, where you will find my business profile that houses all of the ways to access me and the things that I offer. All right, y'all. Y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.